So with that, I'm going to turn it over and talk to you just for a few minutes about doing that sugar that Cheryl talked about with your clinicians and with your clinic, and talk about advocating for the best PKU care. So for those of you who are in Salt Lake City, you might remember that we had a keynote on, at that point, the very recent medical and dietary guidelines that have been released for PKU. And so really, I just want to do a quick reiteration of those guidelines to make sure that you know all about them and you're using them as a tool with your clinicians. So a little bit of a history lesson again. So back in 2000, the National Institute of Health held its first consensus conference on PKU and published a paper which is basically known as the PKU Consensus Statement, which talked about big ideas in terms of PKU treatment and what should happen, basically on the forest level and not the trees level. This was actually, I believe, the first time, at least in a federal publication, that they said that everybody should be on diet for life, that treatment should be for life. A lot happened from 2000 to 2012. We had the first medication approved by the FDA for PKU. A lot new research had happened. A lot new other therapies were in development. And so in 2012, the NIH convened a scientific review conference for PKU. I participated in that conference, many members of our scientific advisory board, many other adults with PKU, parents of children with PKU also participated. And one of the results of that scientific review conference was that they recommended that specific medical and dietary guidelines be developed for PKU. And so the American College of Medical Genetics and Genomics and Genetic Metabolic Dietitians International took that charge from the National Institute of Health, and they released the guidelines back in January of 2014. How many of you are familiar with the guidelines? Okay, so maybe half of you. So I'm so glad that we decided to do a little introduction or a refresher course, because these are a very, very critical tool to advocating for your best PKU care. How many of you knew that PKU is no longer called PKU? It's now called phenylalanine hydroxylase deficiency. I'm not changing our organization to the National Phenylalanine Hydroxylase Deficiency Alliance. Whew. But I think in the wise way that sometimes doctors are, perhaps, right, that they realized, right, that everybody essentially has a different form of PKU. Even my two kids who have the exact same PKU mutations have different fee prescriptions, are on different formulas. Nobody with PKU, unless maybe you're an identical twin, and I know we have a few of those actually in the room, have exactly the same type of PKU, right? Some of you have responded to Kuvan and have been able to increase your fee tolerance. Some of you haven't responded to Kuvan. Some people only get 125 milligrams of fee a day. My 8-year-old gets 300 milligrams of fee a day. My 10-year-old gets 360 milligrams of fee a day. Some of you get 500 milligrams of fee a day. I have one kid that also has ADHD and one who doesn't. Everybody's PKU is different, and it's on a spectrum. So that's why I think they were trying to say that there's no just one size fits all when it comes to PKU. Not surprisingly, we all know that treatment should begin as early as possible. They also said that genotyping, in other words, getting your mutations tested, is recommended. That may improve your therapy planning, and it will certainly improve research. And now, because of these guidelines, some insurance companies that may not have covered mutation testing in the past might. How many of you know your mutations if you have PKU or kids PKU? Go back. Next time you're in the clinic, ask about that. Because, of course, that's also stuff that we're going to want you to input into that patient registry. And the more information we have about people with different mutations or similar mutations, that's going to help drive research and innovation forward in PKU. Now, we all know that treatment is for life. Treatment is lifelong, and these guidelines recommend that everybody, regardless if you're a child or you're an adult, keep your levels between 2 and 6 milligrams per deciliter for life. This is different than what I was told in 2005 when Connor was born. I was told that when he was, a teenager or 10 or 11, he could maybe go up to 10 milligrams per deciliter. And I was like, yes, no more. This is really, really hard, and it's really, really challenging. And I want to let you know that this is what you need to aim for. Will you always get there? Maybe, maybe not. Maybe not with what we have now. But as we look at the development of new therapies, there's more new therapies in the development for PKU now than in any other time in our history. So if you can't get there now, you might be able to get there 5 years from now, 7 years from now. This is what you should aim for. The guidelines also say that people who are off of treatment should go back on, and that they'll likely see some improvements when they go back on. They also talked about treatment options. Medical foods, formula, and foods modified to be low in protein are medically necessary and should be considered as medications. This is very important for our insurance companies. There's a lot of people now, when they're fighting insurance companies, they're also including copies of the medical guidelines. These are guidelines that we're sharing with the FDA and saying this is why our population needs to be on treatment for life. This is why, federal government, you shouldn't cut off people when they're 22 from medical foods. The guidelines say that any combination of therapies that improve a person's blood Phe levels is appropriate and should be individualized. Medical foods should be used to treat PKU, Kuvan, large neutral amino acids, anything that helps you improve your Phe levels and improve your clinical symptoms of PKU is appropriate. And they also said that everybody should be offered a trial of Kuvan. The guidelines also said that anything that reduces your Phe, anything that increases your tolerance, again, anything that improves your clinical symptoms of PKU should be continued. Genetic counseling should be offered as an ongoing process. And due to what we know with research and the risks of neurological and psychological neurocognitive issues, regular mental health screening is warranted. How many of you, when you go into your clinic, are asking, should I have these different assessments done to make sure that I'm on track? These are the things that you need to be talking about with your doctor. Now, my doctor's not here, and this picture of him is probably about 20 years old. But when we go see Greg, these are things that I talk about with him, even as the director of the National PKU Alliance. We talk about what's best for my kids based on these guidelines. But before, when we were seen at a smaller clinic in Wisconsin, I went there like 2 years ago. They handed me a 7-page document, and they said, this is what you can expect for your treatment of PKU for your kids. Have any of you ever walked into your clinic and been handed a document and said, this is what you can expect? This is how we're going to treat your PKU? Anyone? That's what these guidelines are all about. So discuss them, use them as a tool. They are up on our website. They're up under the education piece. It says PKU medical guidelines. Download them. There's summary flyers out there that I know BioMarin has put out from that have like the ACMG logo. John and I also put together a type of flyer that's on our website. I'm sure it's on the NPKUA website. So use them as a tool to make sure that you're getting the best possible care, whether you're an adult with PKU or whether you have a child with PKU.